So our topic today is going to be the advanced practice physio. So for our listeners that don't know, what does it mean?
That's first of all, the definition of what advanced practice physio is very regional and very dependent. In the United Kingdom, it means a certain thing. In Australia, in Canada, again, they all have different meanings. But I think probably the best way to think of it, conceive of it, is just as there are nurses and nurse practitioners, there are physios, and let's call them physio practitioners if you want to, advanced practice. Now, that doesn't mean they're better, but they've gone on to do other more specialized training. And what their job is different than the bedside nurse, a nurse practitioner's job. They're not trying to displace the physician. They're not trying to take their job. They're trying to ensure that the patient gets the best possible care at the right time. And advanced practice physio really got rolling in the United Kingdom back in the 1990s when the government at the time realized that, look, just again, because they have a mixed social health care, private health care system, the national health system, and they were just throwing money at the national health care system, specifically to physicians, and thinking, well, we just give more money to physicians, that's going to fix healthcare. And of course, it didn't. And so what they did is they said, okay, now look, all you other health professionals, dentists, podiatrists, physiotherapists, whoever, we've got a problem here, and if you think you can help us, come and talk to us. And to their credit, the Chartered Society of Physiotherapy in the United Kingdom put forward a really strong case, a really strong submission, saying, look, we are experts in a large range of healthcare problems that involve mobility and function. Why don't you let us do our jobs properly? We've got trained people who can help you. And the government at the time initiated a process. And they have now gone through, and it goes by different names. The United Kingdom, it used to be called extended scope, but I think we're now kind of all using the same terminology of advanced practice. And so there's now a highly formalized training process, university-based, United Kingdom, and physiotherapists there can train up to a level where they order all diagnostic imaging, where they prescribe a certain scope of medications, where they can refer directly to all medical specialists, where they can do injections, joint aspirations. And so they're able to be this first contact, particularly in the area of musculoskeletal medicine, but they're now expanding that out to other areas of specialization within physiotherapy, say women's health, etc. And so, but we'll focus primarily on the MSK side of it. So in the United Kingdom, they really have taken the bull by the horns and have a highly formalized training process where physiotherapists can work their way through a post-professional training system towards being this advanced practice physio with more and more rights and operate, again, at that level of the physio practitioner, if you want to call it that. And it's fully funded by their national health system. I've got several friends in the United Kingdom who work in that and do a great job. And when they recognize that the person is outside of their scope, well, then of course then they're not going to try to just continue treating the person. They work with the medical colleagues that they work with, and so that's what the things really got started in the United Kingdom. Then not too far behind it, Australia, New Zealand, particularly Australia, again with their mixed private-public system. In their public system, again, they realized, look, again, just throwing more money at medical care doesn't fix the problem. And so again, they have now I believe it's two university-based advanced practice programs that train physiotherapists to work at that level. Still have quite a few friends back in New Zealand. I was just speaking to a couple of them last week on a Zoom call like this. And their system is like Canada's, so I think they and us are very similar in the sense that there's not a formalized university-based post-professional training program towards advanced practice, but there are physiotherapists fulfilling that role. And the New Zealand and Canadian systems are very similar. I'll speak to the Canadian system because the New Zealand one pretty well mimics it in many ways. So here in Canada, as I said, we have a socially funded medical system, not a health system, a medical system. So if you want to go to any physician, if you want to go to any hospital in the country, it's fully funded through our government health system. There are, however, health services outside of that. Optometry, dentistry, podiatry, physiotherapy are not covered necessarily by the health plans that are administered by each province. So physiotherapy treatment is a separate issue. But within, again, advanced practice physio, what we found is that because we have social health care system, there is only one lineup to see that orthopedic surgeon for your hip replacement or your back problem. And it doesn't matter if you're Bill Gates or the person living under the bridge, there's one lineup, and no matter who you are, you get at the back of the lineup.